All right, I am just entering the patient's room. I have introduced myself as Sarah, the provider today, and this is my patient, Hattie. And she is here today for a respiratory system return. And we've already gone over her past medical history. And she's reported to me that she does have a history of asthma. She is currently taking a Q4 inhaler, 2 puffs twice a day. And she's also taking an albuterol inhaler. She's taking about 2 to 4 puffs, about average 2 to 4 times a day as needed. She is a runner, so she does seem to use that more when she is participating in sports. She's also taking a Claritin tablet, 10 milligrams every morning just for seasonal allergies. Aside from that, she does not report any other past medical history and seems to have a clean bill of health. So we're just going to go ahead and start by assessing her overall respiratory status. We have already noted that she's not having any respiratory distress. She's not using her accessory muscles when she's breathing. We haven't noticed any cyanosis anywhere on her extremities when we have checked for that. There's no cough, no wheezing, no stridor, no shortness of breath. Her skin is warm and dry, and she's breathing at about 16 breaths per minute. So I'm going to go ahead and we are going to check her trachea at this time. We just want to ensure that it is midline. Okay. Can you take a big deep breath for me? Okay. You swallow for me. Very good. Okay, so trachea is midline, and there is no deviation and there is no tracheal tug noted. So we've also noticed that her thorax is symmetrical. There's no chest wall deformities. I don't notice any scarring upon visualization of her anterior chest. And her chest wall movement is symmetrical with respirations. At this time, we're going to go ahead and check for tactile fremitus on her anterior portion. So can you go ahead and say 99 for me?
99.
Say again.
99.
Very good. Nothing noted as far as tactile fremitus on her anterior portion. Now we're going to check for chest wall expansion. So can you just take a big deep breath for me? Let it out. One more time. Okay. Chest wall expansion is symmetrical bilaterally. No deviation or asymmetries noted there. So we are now going to percuss her lung fields. Everything sounds great anteriorly. We have resonant percussion noted as far as anterior. We're going to go ahead and listen to her lungs anteriorly at this time. Just take normal breaths for me. We have normal vesicular breath sounds bilaterally anteriorly. So now we are going to check for bronchophony. So we are going to have Hattie say 66 while I am auscultating her. So just go ahead and say 66 each time.
66. 66. 66. 66. 66. 66. 66. 66. 66. 66.
Very good. So now we are going to go ahead and listen for whispered pectoroquilology. And in order to do that, I'm going to have her whisper 99 anteriorly. Can you just whisper 99 for me? Very good. So I do not know any consolidation anteriorly. And so now we're going to listen for egophony. And so I'm going to have you say E each time I am listening, okay?
E, 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 E.
Very good. So I do not know any consolidation as far as when she says an E sound. If consolidation were noted, it would sound like an A sound. So we are going to move to her posterior now, do the same test. So I'm going to start by checking for that tactile fremitus. So if you could just say 99 for me.
99,
And one more time.
99.
Okay. Everything appears to be normal there. We're going to go ahead and check for that chest wall expansion now. Can you take a big deep breath in for me? Very good, and let it out. One more time. Very good. We have symmetrical movements bilaterally with her chest wall expansion. So now we are going to go ahead and percuss her posterior section, and we are going to percuss all lung fields. Everything appears to be normal there, and we have resonant percussion noted. And so now we're going to go ahead and listen to her posteriorly. Can you just breathe normal for me? We have normal vesicular breath sounds noted. I'm going to go ahead and have you turn around for the remaining portion of the exam so that we can see that on the screen. So can you just put your feet over here? And so now we are going to be checking for the special test again, the bronchophony. And so again, Hattie, I'm just going to have you say 66 while I'm listening to each side, okay?
66, 66, 66, 66, 66, 66, 66, 66, 66, 66.
Okay, everything does appear to be normal there. I am able to hear her okay. And so now we're going to again check for that whispered pector quillogy. And so this is where we're going to say 99. Appears to be normal as well. There's no consolidation noted posteriorly. And so lastly, we're going to listen again for the egophony. And so this is where I'm going to have you say E at each site.
E, 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 E.
Okay, and by auscultation, her E does sound like an E, and there is no consolidation noted. Again, if there was, it would sound like an A. And so that concludes our respiratory exam today. We're going to give Hattie a clean bill of health.